Have you recently been diagnosed with high blood pressure? Is your doctor recommending that you take hydrochlorothiazide, but you're concerned about the possible side effects? If so, then this is a video for you. Keep watching to learn a little bit more about what side effects to watch out for and why this can be an important medication for you. Welcome to Family Med. I'm Dr. Richardson, and this is your home for practical and accurate information to help your family make healthy decisions. This is the channel that focuses on bringing better health to your home. On today's episode, we're going to be talking about one of the most common medications that we use to treat high blood pressure called hydrochlorothiazide. To help us learn a little bit more about this medication, I'm going to tell you the experience of one of my patients who I recently started on it. To protect her privacy, we'll just call her Mary. Mary is 52 years old and came into me for a routine physical. She's actually been a better patient than most and comes in for her usual checkups. She's been trying over time to have a better lifestyle. She's been putting in some effort into her diet, but has been struggling getting in her exercise. We noticed that over the past couple of years, her blood pressure has been creeping up. I talked to her a little bit about her parents and her siblings, and it turns out that both her father and two of her sisters have high blood pressure and are currently being treated for it. When I saw her in the office, her blood pressure was 160 over 100. She just had a pretty stressful day, and she was running around, she was late, had almost gotten in an accident. She's coming to the office. So we let her sit for several minutes to calm down, but when we repeated her blood pressure, it was still 153 over 96. So with her current elevated blood pressure and the prior ones that we have been seeing over the past year or so, I diagnosed her with high blood pressure. At this point, she was kind of resigned to it, wanting to learn a little bit more about what she should do about it. So we had a great discussion about blood pressure and why it's so important to treat it. I told her that the reason we care about high blood pressure is because the impact that it can have on your overall health. You see, high blood pressure is a leading cause of cardiovascular disease to include heart attacks and strokes, as well as it plays a significant role in chronic kidney disease. Oftentimes, we refer to high blood pressure as a silent killer. It's called this because it typically doesn't have any symptoms. Now, when you take your blood pressure, you get two numbers. The top number is called the systolic blood pressure. This is the pressure your heart exerts on the vessels when it contracts. The bottom number is called the diastolic blood pressure. That's the resting pressure in your blood vessels when your heart isn't beating. Both numbers are important. Now, for most people, we diagnose high blood pressure when your numbers are over 140 on the top and 90 on the bottom on a consistent basis. So in Mary's case, with her blood pressure being 153 over 96, she was at increased risk of having a heart attack or a stroke at some point in her life. Now, this certainly was a concern for her because she saw her grandmother have a stroke and had watched her suffer the last few years of her life from the effects of it. So she really wanted to know what she could do to help decrease her risk of this. She was hesitant to want to take anything for it though, especially because she really was feeling well otherwise. I told her that she wasn't really alone in that concern. In fact, it's one of the harder things that I have to do is to help people understand how important it is to treat blood pressure, especially when you're not having any symptoms. I told her that you don't want your first symptom, though, to be a stroke. So that seemed to get her attention. So she asked a little bit more about what needed to be done. We had a great discussion about diet and lifestyle changes. We talked about how she needs to be exercising 5 times a week, avoiding excessive salt in her diet, watching the refined carbohydrates, and focusing on getting lots of fruits and vegetables in her diet, as well as ultimately working on some weight loss. She felt that there were some things that she could do better with her lifestyle, but overall she felt that she'd been trying pretty well with those things. She wanted to know what else could be done. Well, I explained to her this is very common, that even with proper diet and exercise, that you can still have issues with high blood pressure. Sometimes we just need a little extra help in controlling it so we aren't at such high risk for the complications of high blood pressure. So ultimately, I recommended that we start her on hydrochlorothiazide to help control her blood pressure. Hydrochlorothiazide, or oftentimes called by the abbreviation of HCTZ, is a medication that's been available in the United States for over 50 years and is still one of the safest and most effective medications to treat high blood pressure. It is used principally to control blood pressure, but it's also used to decrease how much fluid in the body for those with congestive heart failure, treat symptomatic swelling or edema in the legs, and is even used to decrease risk of certain kind of kidney stones. Now, hydrochlorothiazide belongs to the class of medications called thiazide diuretics. Thiazide diuretics, like HCTZ, work by blocking electrolytes like sodium and chloride in a certain part of the kidney from being absorbed back in forcing water to leave the kidneys as urine. Basically, it takes extra fluid from the blood and makes you pee it out. By taking out the extra fluid from the blood, though, it helps to lower how much blood volume is in there and therefore lowering the blood pressure. But the best part is, not only do they help lower your blood pressure, but they've also been shown to help decrease your risk of heart attack and stroke, and they can be quite effective for most people. This is why I felt this might be a good choice for Mary. Mary wasn't a big fan of taking medication, but knowing how important it was to treat her blood pressure, she started to warm up to the idea. She still had some concerns about taking them though. She was worried about whether she could even remember to take it. This is always a concern with medication, but hydrochlorothiazide is pretty easy to take as you only need to take it once a day. It comes in a tablet of 12.5, 25, and 50 milligrams. Most studies though have shown that the safest doses of this medication is 12.5 to 25 milligrams. I usually don't prescribe more than 25 milligrams a day. Now another concern that she had was whether it would be something that she had to stay on her whole life. Now this is a great question, one that many don't like the answer to. It's important to understand that with hydrochlorothiazide and any other blood pressure medication, it only works while you're taking it. We don't have anything that will cure high blood pressure. So I explained to her, I have people come in all the time with their blood pressure high after we originally had it controlled, telling me that they stopped the medicine because we fixed it. Now, unfortunately, this is not the way it works. Unless you have some underlying lifestyle issues that are causing your high blood pressure, and you fix those, you need to stay on these medications. Don't stop them unless you discuss it with your doctor. Now, if you do make some significant lifestyle changes and your blood pressure starts to drop, then, under the direction of your doctor, they may be able to pull back on how much you're taking or even get rid of it. This isn't the norm though, and unfortunately, sometimes we just have high blood pressure, and in order to prevent that heart attack and stroke, you need to stay on your medication. So at this point, I think I had her a little more convinced that this may be the route that she wanted to take. However, she was still concerned about any side effects. Now, fortunately for most people, that's the great news about this medication. Hydrochlorothiazide is usually well tolerated. It's not very often that I have a patient want to stop it because of side effects. Now that being said, any medication has a potential for side effects, and hydrochlorothiazide is no different. I explained to her the most common side effects that we tend to see with HCTZ are some depletion of your electrolytes. Sometimes this can cause some muscle cramps. It can also cause some dizziness, diarrhea, abdominal pain, headaches, decreased appetite, sensitivity to the sun, and a feeling of weakness. Now, the most common one that I see though is it just makes you urinate more. That's the whole point of taking it, so it should be expected. However, if it makes your lifestyle difficult to go to the bathroom often, then you may have a problem with this medication. I've also noticed though, people tend to get used to that over time. Now, the other side effect that I see is more often is dizziness or feeling lightheaded. This usually is a sign that medication is working too well. If this happens, typically you may notice that when you stand up, you get that head rush feeling. You may feel like you're going to pass out. If this is happening, concentrate on standing up slower, check your blood pressure, and bring those to your doctor so you can talk about it. Sometimes all you need to do is just adjust the dose. Now, there are some more serious, albeit rare reactions that you should be aware of and watch for. The more significant side effects to watch out for are significant electrolyte imbalances like very low potassium or sodium levels. It can put you at risk for pancreatitis, certain severe skin rashes, certain kinds of anemias, and kidney failure. All these are very rare, but it's why it's important that you follow up closely with your doctor. We usually like to get semi-frequent blood work done while on these treatments to make sure that you're not having any of these problems. So, just like you, Mary, after hearing some of these possibilities, was a little nervous about taking the medication. But I'll tell you, just like I told her, you have to step back and look at the big picture. The risk of these side effects is very small, and some of which I've never ever seen. So don't let the fear of a rare side effect put you in danger of the very real risk that untreated high blood pressure brings. It'd be the same as saying that you don't want to drive to the hospital when you're sick because you might get a car crash. So as long as you're paying attention to how your body is responding and following up closely with your doctor while taking them, you should be just fine. So that seemed to do the trick in helping Mary be a little more comfortable starting something like this. If she still had one hand, she was worried because she had heard about how expensive medications can be. Now luckily I was able to calm her fears about this as well. Hydrochlorothiazide is usually very affordable. Most places you can get a 30-day supply for between $4 to $5. So Mary finally decided this was the right course of treatment for her. On a follow-up visit, her blood pressure dropped from 153/96 to 133/76. She had a significant drop and was feeling a lot better. She especially liked the fact that she wasn't retaining as much water and felt a lot less bloated than she had before. Now, subsequent blood work showed that her kidneys were doing just fine in handling medication. So overall, hydrochlorothiazide can be a great medication for most people. It was for Mary, but like most medications, they aren't for everybody. If you're thinking about it for yourself, there are a few groups of people that should be cautious about taking it. Those who should avoid taking it, or be cautious at least about taking it, are those who have a significant allergy to sulfa drugs, those who have significant kidney disease, severe liver disease, a history of gout, those who have lupus, or who are already prone to electrolyte disturbances. Work with your doctor to find out the right one for you. So if diet and lifestyle changes have not been enough to control your blood pressure, and your doctor recommends that you take hydrochlorothiazide as part of your treatment regimen, hopefully you have a little more confidence in using this as part of your treatment plan. This certainly isn't an all-inclusive and in-depth discussion of everything that could be told about this medication. That's not what I'm trying to do here. My purpose in sharing this information is to help give you information that you can think about and discuss with your own doctor. Please don't take this as direct medical advice. Take everything you've learned today and discuss with your own doctor how it applies to you in your own situation. If you found this information to be helpful, do me a favor. Go ahead and hit that like button and share it with your friends and family. And if your health is really important to you, consider subscribing and hit that notification button so you don't miss out on any of our other content. Now don't go anywhere, because if you're looking for ways in order for you to make some good lifestyle and diet changes to help treat your blood pressure, go ahead and click right here to watch simple steps that you can take to start your diet journey. And if you're looking for another option to treat your blood pressure, click here. So until next time, this is Family Med with Dr. Richardson. And remember, take care of your body, because it's the only one you have.